is Russell Harrington. I go by Russ. My role with Baptist currently is President Emeritus, having served here for 40 years, 30 years, so that the last 30 years was CEO. Before Mr. Gilworth retired, we talked about the conversion of our 1 or 2 hospitals at the time to a system of hospitals. And that's how the Baptist medical system was formed at that time. And again, I didn't have a goal to add a lot of hospitals, but I did have a goal of finding ways to expand our ability to take care of people. And it just so happened that the opportunities came to us. We never went out and sought to build another hospital or to take over another hospital. Every time we had another hospital added to the system was because someone invited us from that community. Someone invited us to come in and take a look. And so that's how we grew from 2 hospitals to 9 before I left, and now we have 11. I always wanted us to try to be a leader in new technology, and we've been able to do that over the years, and I think that's continuing. We were the first to have a cornea care unit, the first to have the heart transplant program, the first to do robotic surgery in the state. I mean, there's a whole list of firsts that we've been involved in. And again, it's really been in partnership with our physicians who helped push us to do things that we needed to do. We didn't ever want to stand still, because the most important thing we do is to provide quality health care. And you can't feel like you've arrived. You have to continue to improve. And so you can do that through new technology. And we just continue to try to do that. I used to try to really keep our focus on our employees. Without them, we're nothing. Not just the nurses and doctors, but it's every person has an important role to play. And I love every level of employee in our organization. I've always tried to keep a good relationship with them because I see their value. I've always had a tender heart for single mothers, especially those who work in nursing. They have a difficult time. I mean, they've got to take care of their children, but at the same time they have to be at work when they're supposed to be. And so we've always tried to focus on taking good care of our employees. I think that is essential if you're going to have a successful organization. So it's not just the doctors, it's not just the nurses, it's not just the therapists, not just the administrative people. It's the whole gamut of employees. And we tried for all the years I was there, at least, to say every role in the hospital is important. You couldn't do without your role or your role. And I hope that most of our employees understood that. I think they did.